tell me about your blog. Is there a good time to talk about it? Well,
Yeah, we can talk about it. Okay. So, no, well, I've gone to a lot of different places and, you know, met a lot of different people and stuff. And I was asked, you know, like, how come you don't ever, like, show where you go or, like, make a blog about where we've gone?
Is that tender where I push on it?
Yes.
Okay.
Yeah.
Right in here?
Yes.
So what I'm doing here is doing both distal and local points. Just trying to hit it from 2 different directions. I think that's good. I can hook up the E-stem. You want to do E-stem?
Yes.
What does the E-stem machine do?
It increases blood flow to the area, and at some level almost tires the muscles out, so when you tire them out, they're going to be more relaxed. That will also allow more blood flow to the area. Yeah, I'll turn it around here.
It's almost like hooking up your car battery.
Yeah, right.
See, I haven't seen it, so I only feel it.
It doesn't hurt.
No, it doesn't.
It's actually, I find it pretty relaxing. Just it's kind of like a TENS unit, but not quite. So now we're gonna turn it on. So I'm gonna start with the right.
Okay.
And you let me know when you feel it. So the first one I'm going to do is going to be from here to here.
Okay.
Okay, tell me when you feel it. Okay, does it feel mild or soft or strong?
Can you do a little more?
Okay, you tell me when you feel like it's the right strength.
Yeah, that's good.
That feels good? Okay.
Yeah.
The next one's going to be from here to the top.
Okay.
Okay, in the middle area there.
Okay.
Tell me when you feel it.
That's good.
Is that good?
Yeah.
Okay. Now, in between your two eyes, you tell me when you feel it.
Okay. Yeah, I can feel that.
Is that strong enough?
Can you do a little more?
Uh-huh.
Yeah, that's good.
That good?
Yeah.
Strong enough?
Yeah.
Okay. All right. So we're good. I think we're all set.
Yes, ma'am.
Okay?
Okay.
All right, I'm going to leave you the button in case you need anything.
Okay.
Okay, just push this if you have any discomfort. And I'll be back. Take a nap, okay?
How long have you been an acupuncturist?
Since 2003, so 17 years.
What made you become one?
It was actually a fluke, and I decided to, my former life in which I did at the same time until moving to Michigan. I was an eating disorder therapist, and I found that a lot of my patients were having a lot of other issues beside what I was counseling them in nutrition therapy, and I wanted to treat them more fully. So I decided to get my degree in Chinese medicine so I could address the anxiety and their abdominal digestive issues and depression and sleep. And it was just a great marriage of the two to really work with patients on their nutrition as well as to treat them mind, body, and spirit with acupuncture and Chinese medicine.
What are your methods of treatment?
I use traditional Chinese medicine, how I was trained, but a lot of my treatments are based on my point strategy is based on the balance method, where I use distal points rather than local points. Today I did a combination of distal and local. When I first started with her, I just did distal points for her knees. So I do master tongue, tan, which is the balance method, and then traditional local points for traditional Chinese medicine. So I'm intuitive with what I feel the patient needs. Yeah.
How long have you been treating Ashley?
How long we've been treating Ashley?
Yeah.
I think it's been a couple of months.
What health issues does Ashley have?
It's primarily pain, but she also has anxiety and some sleep issues. So we worked on the knees because as an athlete, that's her priority. That's why she came here. But during the course of her time seeing me, there were some other issues that came up with relationships and anxiety and not being in her home state. She's a visitor here. So it was Thank you. So it was a combination of treating her anxiety as well as her pain.
Will her health issues eventually go away?
I think so. That's the plan. We don't want her overly dependent. Yeah.
Since Ashley is an athlete, what do you want to tell other athletes about acupuncture?
Is that acupuncture is a great way to improve your energy, to keep the blood flowing to your whole body. So we have to remember that Chinese medicine is a whole body treatment. When Ashley comes in and I treat her knees, it's actually treating her whole body. And that if you do acupuncture at the first sign of any ache or sprain or strain, you have to remember that acupuncture can help promote and increase the rate of healing. So if you have an injury, most people just do physical therapy. But if you do acupuncture, what acupuncture does is actually reduce inflammation, reduces pain, and then you can do physical therapy to promote the strength of the part that's been injured as in sports injury. So my message to athletes is you really should consider, I invite you to consider acupuncture as part of your regimen to keeping yourself healthy. It helps build your immune system. When you travel as an athlete, you can get run down. Acupuncture is really good for that. It promotes blood flow and energy to your limbs that you're using, and it helps relax you. Which remember, a big part of being an athlete is your psyche, is where you are psychologically, mentally before going into a game. So acupuncture can help stabilize and regulate all of that.
That's good.
I'm smiling under the mask.
I'll put a smile in the video.